Welcome to the Douglas County Greystone Power Luncheon. I'm John Sell with Georgia Power, and I'm your 2013 Chairman of the Chamber Board. Before we give thanks for today's lunch, I would like to offer a special thank you to Folks Southern Kitchen for catering. Give them a hand. At this time, I'd like to ask Reverend John Pinson with Douglasville First United Methodist come forward and lead us in the invocation and then the pledge.
Thank you, John. Thanks, John. What do we want to ask God for? Praise. Grace. What about the market? My phone tells me my stocks are down, especially a lot of Georgia stocks. I guess we need to ask the Lord to be with all the world, right? And the businesses, about your businesses here. Let's pray. Lord, we call upon you to look down upon us with your mercy and grace, and give us the drive and determination to make our part of the world a better place. Be with these men and women this day as we are seeing reforms in healthcare, changes in business. Give all these that are gathered here this day, Lord, extra wisdom for the day and time in which we're living. Thank you for this meal, and may we use it to nourish our bodies so that we can continue to serve you and the companies we represent. In the name of the Father, and of the Son, and the Holy Spirit. Amen. Will you stand and join me for our pledge? I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
Today we're sponsored by Wellstar, and at this time I'd like to invite Craig Owens, President of Wellstar Douglas Hospital, to come forward and give us a few remarks.
Well, thank you, John. It's a pleasure to be with you here today, and I have some exciting news for you. Our hospital is growing again. We are breaking ground on a hospital expansion on May the 16th at 11:30. I encourage you to mark your calendars and join us as we put the ceremonial shovels in the ground and start our expansion. We are doubling the size of our ICU. We have an 8-bed ICU at the hospital right now. And pretty much every day this year, we've had more patients than we've had beds. So we are in the need to grow that service, and so we'll start in May. And it looks like about between a 12 and 14-month construction time frame to have our new beds online. This year has been interesting for us. As you're probably aware, this was a difficult flu season, and it caused a real surge, particularly in our emergency department. So we've seen record volumes in the hospital. And our team has responded and done an outstanding job in taking care of our community. But we're excited about the growth. Once we finish the ICU, we're going to add some additional capacity in our emergency department to care for the needs of our community. We're really excited to have one of my colleagues, Barbara Corey, here with you today to talk about healthcare reform. And there's a lot of information out there, a lot of good information and a lot of not so good information. And people have asked me, is healthcare reform a good thing or is it a bad thing? And I say yes. We are in need of a lot of folks are in need of coverage and healthcare insurance, and I think that's going to bring a much needed relief for some people. I do think as well that we're going to be challenged on the cost side as a nation and as a healthcare system. So I'll be pleased to hand the microphone back over to John for the introduction. Thank you.
Thank you, Craig. We're blessed to have a great hospital like Wellstar Douglas as a partner in our chamber and to support our community, so we appreciate your support today. At this time, I'd like to ask our elected officials to please stand and recognize and introduce yourselves. We'll start back there with Henry.
Harvey Persons, Mayor, City of Douglas
Thank you very much. Let's give them all a hand. Okay, these next people I'm going to introduce are very important because they are salespeople today. Every one of them has raffle tickets. We will have our annual chamber raffle on May 30th at the Center for Arbor Connections at our after hours. But the sales started today, this morning. So some of you probably got hit up by some of these folks, but at this time, I'd like our board members for the chamber to please stand to be recognized. We'll go ahead and introduce.
Randy Whitaker, like those dogs, I got a deal going 10 for $1,000. North Prince, Douglas County Schools. West Georgia Tech.
Stacy Hamby, Douglas County Bank, and I have had 3 $500 winners the last 3 years in a row.
Greg Owens from Douglas. I only sell winning tickets.
We all win when you buy tickets, so please see some of the board members and buy those tickets. Buy early and buy often, and we'll have a great sale this year. At this time, can I get the chamber diplomats to stand as a group and be recognized? We're also very proud of our 2013 Chairman's Club members that join us. I'm sure many of you noted them on the slides prior to the luncheon, but I want to take a moment to say thank you and recognize the group sitting up front. Chairman's Club, thank you. And today we're announcing our newest Chairman's Club member, and at this time I'd like to welcome the Douglas County Water and Sewer Authority, represented by Mr. Pete Frost, as our newest Chairman's Club member. WSA has been a long-time member and supporter of the Chamber. Pete, please come forward and tell us a few things about WSA.
We have been a member of the Chamber for quite some time and decided to become a member of the Chairman's Club. So I am the newest member. I'm a relatively new employee here in the community. I've only been here since 1985, but wanted to tell you just to take a moment. I would assume most of you either work or live here in Douglas County, and so you probably know who we are. We're the people that you get your water bill, your wastewater bill, and probably the most misunderstood bill that we send out is your stormwater bill. You know, we're your water service provider, and if you have any questions, please contact our office, and we'll try to get you some answers if you have any questions. Don't think I need to say any more than that. Thank you.
Pete, we appreciate your support. We especially thank you for all the work that your folks did, like on a night like last night where we had all the hail damage and trees down and lots of water. So that's a good thing and a bad thing, right, Pete?
Right.
Okay. It's now my pleasure to introduce our speaker today. She's Barbara Corey, Senior Vice President of Managed Care with Wellstar Hospital. Barbara joined Wellstar in 1999. In addition to managed care, she has responsibility for Wellstar Health Place, Wellstar Retail Operations, and the system's daycare operations. Prior to joining Wellstar, she was Director of Operations with Prudential Healthcare and has been an expert in this field for quite some time. And we're not going to draw this out in a big lengthy thing, so Barbara, come forward and please address the chamber today. Thank you.
Well, good afternoon. Thank you, John, and thank all of you here at the Chamber for allowing me to spend some time with you this afternoon. I was asked to speak about healthcare reform and the impact that it has on employers as well as healthcare providers. And so if you'll indulge me for just a few minutes, I know you guys know Craig, or most of you guys know Craig and what we do here in Douglas, but I'd like to tell you just a little bit about Wellstar as a whole, and then talk at a high level about the Accountable Care Act. And then I thought I would talk about it at a high level from 4 perspectives. So from the perspective of an individual, of an employer, and a payer, and then also as a healthcare provider. So just to give you a broad sense of the bill and how it impacts all those different areas. Wellstar itself has been in the various communities that we're in for over 60 years. Our hospitals were developed through hospital authorities that are still in effect today. And we became a system in 1993, and actually we're very excited that this spring will be the 20th anniversary of Wellstar Health System. We have always been and continue to be a not-for-profit health system, which simply means that all the dollars that we earn from operations are reinvested right back into the community in terms of services and programs that are offered to that community. We have 5 hospitals, as some of you may know, 6 urgent care centers. We just opened a health park out in Ackworth, which is the first of its kind. And the idea behind that is to bring a number of services like outpatient surgery and imaging out into the community and away from some of the congestion of some of the hospital campuses. In addition to that, we have over 900 physicians on our medical staffs at our hospitals, and in our Wellstar Medical Group, we have 550 providers, which are physicians and advanced practitioners. In terms of economic impact, we have almost 13,000 team members at Wellstar, and those team members generate payroll in excess of $600 million. And when we break that down to Douglas, that's about $56 million in payroll for about 1,200 team members that are here in Douglas with Wellstar. And a number of those folks are here with us today, and I appreciate their attendance and support. The Hospital Association of Georgia in 2010 did a study, and it impacted that Wellstar's 5 hospitals generate more than $2.2 billion in revenue for the local and state economies. And then finally, Wellstar does contribute over $200 million a year in terms of annual community benefit, and almost $100 million of that is in charity care for folks that are uninsured or do not have other ways to pay for healthcare services. So with that said around kind of the broad Wellstar picture, want to shift gears and talk a little bit about the Accountable Care Act itself. And as Craig said, is it good or bad? I mean, that's a question that's really been asked around the country. And this is the result from a Deloitte study that was done back in February of 2012, so it was actually prior to the election. But it kind of gets at what Craig was saying, which is they ask, is it a good start or a step in the wrong direction? And 38% of the folks polled thought it was a good start, 29% thought it was in the wrong direction, and 37% had no opinion whatsoever about it. What is really interesting about this, so while the majority of the country probably doesn't think it's the answer to health care, it is important to note that the majority does like certain elements of it. So they like the fact that it broadens access without pre-existing conditions, and they like the fact that it's helping to drive this push to have reimbursement for health care be more value and outcome-based versus just a click fee-for-service, you get paid for every service that's provided environment. And I think the other thing that's important to note is while the two political parties may have different approaches to this and different ways of looking at it, I think from the country standpoint, one way or the other, we have to have an impact on decreasing healthcare costs. Businesses, as you all know, simply cannot afford to have the increases that they're having year after year. So I think because of that, most people feel like there's going to be movement and changes within healthcare, and that portions of this Health Care Act are going to continue and be implemented. They may be tweaked along the way, but one way or the other, we're going to have healthcare reform in the country. So when you look at the Act itself, it really has 3 key components. So it's access, quality, and cost. And there are numerous components to this Act that are really bucketed into those 3 areas. And so just to give you an example for each area, for example on access, in 2014 you'll see the healthcare exchanges come online. That they were intended to be for individuals and small business. The small business exchange has now been postponed for a year, but we're still looking at 2014 for the individual insurance exchange. And I'm going to talk a little more about that in a little while, but that was really designed to give broader access to health insurance to folks that have not been able to access it previously. In terms of quality, you can see in 2015 that Medicare is no longer going to pay physicians unless they provide and report certain quality data. So looking to be able to be transparent and have that information available to the public, and if folks fail to do that, then there will be a financial implication for that. And then around cost, the payers themselves are actually have a number of provisions that are going to impact the insurers and how they price products and what they're able to do. So there's restrictions around how much of the premium dollar has to be paid out in medical expenses, and a number of other provisions related to that. So those are just giving you some examples of numerous components that are embedded under each of those three categories for the Act. The timeline that really started in 2010, 2011, certain things came into play. A lot of the activity really focuses around 2014, and again, a lot of that is driven by the individual mandate and the health exchanges. But there are provisions that come into play and go past 2014 all the way out to 2018. So like any legislation or any change, there's opportunities and challenges associated with that. And I think one of the main opportunities that this act has created is sort of an urgency for innovation within the industry. So I'm going to show you in a slide in a few minutes, but you have organizations talking to other organizations that might never have really thought about working together in the past. And you have healthcare systems like ours and others all around the country that are really working hard to figure out how to bend that cost curve and improve quality and outcomes. You have insurers really looking at how to reinvent themselves and what is it that their role is going to be in the future if things progress down this path of healthcare reform. So it really has created a burning platform within the industry to look at how to decrease costs and improve quality. It also presents an opportunity for the focus on having a truly coordinated, integrated healthcare system. I think the components are out there and in place, but that ability to tie technology and providers and all of these things together in a way that's seamless to the patient is an opportunity that's out there to be developed and had. And then also it creates an opportunity for us as communities and employers and individuals to really look at sort of the unhealthy lifestyles and behaviors that are in both our own actions as well as in our environment, and how we might impact those to improve the overall health and well-being of our communities. This is just a slide that shows you some examples of some different things that have been going on around the country that get at what I was saying about the kind of different collaborations and different ways of looking at things. So you have United, which is a large national payer, Humana, the same thing, both purchasing provider groups in certain markets. You have DaVita, which is a dialysis company acquiring a large medical group out in California. So again, some very different partnerships and marriages, if you will, coming out of this healthcare reform activity. Some of the challenges with this, just based on the sheer volume of the regulation and changes. So KPMG stated that there was over 2,400 pages associated with this regulation. In addition to that, Deloitte has cited that inside that regulation there are over 1,000 the Secretary shall directives. So for each of those directives, there could likely be hundreds of pages of rules and regulations that come out of that. So it is a massive, massive legislation, and you've heard that out in the media and such. And so because of that, organizations all over the country, Wellstar and others, are spending a lot of time digging through those, trying to understand those, trying to figure out how they impact your business and how they need to be addressed. And the result of all that magnitude is really probably will be some unintended consequences. So that's part of the unknown today is with all those moving parts and all those moving pieces, what's going to happen that wasn't really intended, and then how are we going to be able to work through that and move through that. The other thing is the bill itself is very complex. It impacts clinical care itself. It impacts insurance services and regulations. It impacts employee benefits and how those are offered. It impacts the individual. It impacts their taxes and the cost associated with that. So it's moving across a lot of different components and areas, and all of those things overlap and touch each other. And then finally, the challenge is just the technology and infrastructure costs that are needed to really redesign the way healthcare is delivered. And so when you look at a system like Wellstar, and we're in the process of putting up Epic, which is probably one of the best national medical records that are out there, and we're deploying that across our system, both our physicians and our hospitals. And that is a significant investment that has to be made to be able to do that. And large systems are able to largely do that and work through that. But when you look at an individual primary care office, that's a hard thing for them to look at, some of the infrastructure and investment costs that are needed to come to be on electronic medical record. So for a lot of folks, that the technology and the infrastructure costs to change things are a challenge. So from the 4 perspectives that I've mentioned, first from the individual, the Act really kind of takes a carrot-stick approach. So the good news is in 2014, there'll be subsidies available for some folks who have incomes less than 400% of the federal poverty level. But that is for those who don't otherwise have access to what's called affordable sponsored insurance. And that's defined as insurance that they can obtain that costs them less than 9.5% of their income. So if you don't have access to affordable sponsored insurance and your income is below 400% of the federal poverty level, then there will be government subsidies available to help you get insurance. And so that's a good thing in the fact that it does expand access. The stick for that is really the individual mandate, which also begins in 2014, so that if you don't have qualifying insurance, then there's a tax penalty that's directed to you as an individual. And there's a lot of debate out in the industry as to how effective this will or won't be. It was intended to be sort of the balancing, so that as insurers brought on new folks into insurance to try to prevent that from being adverse selection, was to have this mandate that everybody have insurance. But a lot of folks are questioning whether the dollar amount, $750, is enough to really force people to do it, whether or not the fact that it's handled through your income tax and that you have to be actually audited to be caught for not paying it, whether or not those are really going to be effective mechanisms to create that balance. From the employer perspective, so employers all over the country, and I'm sure a lot of you all too, are really trying to figure out how the law affects them and how it doesn't affect them. And it's very hard to generalize because a lot of things depend on the size employer you are, your demographics, what your current benefit strategy is, and where you're located. And so because of that, there's a lot of folks really trying to figure out what do the next few years look like, and do we participate in an exchange or do we not? And so that has created a big impact on employers. And it's going to require that they change their benefit strategy that's delivered to their employees. From the payer perspective, there's also a number of changes around benefit, underwriting, medical loss ratio, and how they can write policies and what they can do around that. And then probably the biggest impact to the insurance companies is this idea of an exchange retail market. So in the exchange, there'll be products available, and individuals and small companies can make choices as to what products will be offered or what they would buy and select. And one of the challenges with this is that it's designed to allow state exchanges, so there'll be variability from state to state. And then there's some states that are not moving forward with exchanges, Georgia being one of those, in which case it's going to default to this federal exchange. And so there's some things that are very probably good and comfortable about this. This is taken from the Massachusetts exchange, which is, they've been at this for a few years. And you can see the bronze, silver, and gold. For the Accountable Care Act, there actually will also be a platinum option. And really the difference in the options is based on how much out of pocket you as the individual will pay. So the bronze level, I think it's that you would pay 40% of the cost of that plan out of pocket, and then it goes down from there all the way up to only 10% under the platinum option. But basically this is a website, and so you just go on and you look at the plan you want, and then you look at the people, the carriers that are offering that plan, and you make your decisions right there online. And then if you have the opportunity to have a subsidy from the government, will be another place to click where it will calculate that for you, and you'll see the impact of that. But this is really disrupting and changing the way that insurance is, or has the potential to really change and disrupt the way insurance is sold in the country. And so various payers are really focusing on this and designing a lot around it. Folks like Humana and Coventry have really focused a lot of resources on understanding the retail buyer mindset, or the individual retail buyer mindset, and how this shift will occur. And it's also forcing a lot of brokers who had previously focused on healthcare to look at other ways to interact with the market as well, and so looking at other supplemental benefits and some things like that. So it's causing a lot of redesign in terms of how people look at the market. In terms of on the provider, there's a lot of moving pieces in the legislation for providers as well. So there are some positives. There's some increases to Medicaid payments to doctors, and that's a positive because that will help increase, hopefully, access of physicians that accept Medicaid patients. There's some increased provisions related to outpatient hospital facilities that are built into there, although there is some concern that those might get cut out as we go forward with some of the budgetary issues. Some of the downsides, though, are sequestration, which impacts Wellstar and other hospitals, a 2% cut annually. And then there's the ongoing sustainable growth rate cuts for physicians that are out there. And this has been going on for some time where it'll be said that the physician Medicare rates are going to be cut by a certain percentage, and then at the last minute Congress comes in and delays that, and so that it's kind of been pushed and pushed and pushed. But right now, what's on the table would be a 27% cut on those rates, which would be significant and would significantly impact the number of physicians who would continue to see Medicare patients. So as you walk across that, when you look at it from a perspective of a system like a Wellstar and others around the country, you're really looking at how do we prepare for the future, and how do we do things that add value to the community, and how do we be part of the solution that really drives down cost of healthcare but improves the quality that's delivered. And so as part of that, we've kind of identified a couple of keys to success that I'd like to just share with you quickly. The first is around cost control. So we know that we have to drive cost and inefficiencies out of the healthcare system. And we've been working hard at that over the last 5 years. And in fact, we've taken $100 million out in operating costs over that time period. We've also adopted lean management principles, and we've begun deploying those throughout our organization. That we've been doing that for probably 3 or 4 years now. We're kind of at the ground level. We're looking at each process and how to improve it and make it more efficient. And as I mentioned earlier, we're deploying Epic, which will bring great efficiencies and patient value, I believe, to our system, because as you go into see your doctor today and you go to get your lab tomorrow at the hospital, they will know you and recognize you, and you will not have to go through all those constant re-registrations that happen today. So really concentrating on that cost control and how to, bring value to our patients and to our communities. This is just showing you some data that sort of substantiates what I said as far as driving costs out of the system. So these are our expenses per discharge, and you can see that Wellstar there is about 8% greater than the Metro Atlanta downtown hospitals, or those hospitals up in the northern suburbs. And then this is just showing you Wellstar itself, that our cost trend for all of our Wellstar hospitals has been decreasing since 2008 and is now 9% less than it was back in 2008. One of the second keys to success, we believe, is collaboration, which I touched on earlier. And hopefully you've seen some things in the news, but we've really created what we believe are some unique partnerships in the market. The first of which is the Georgia Health Collaborative, and that's a collaborative between us and Piedmont Healthcare. And right now that group is really focused on a couple of key areas that we think there can be some value, again, to patients in the community by us collaborating. So our physicians are working together around quality initiatives and how we share that information. We're looking at how to continue cost reductions in the form of supply chain management and those type of things. We are working on an insurance and network development, which I'll share a little more with you about in a second. And then we're looking at other ways to collaborate and do joint ventures. And so this is a great example of where I was saying, 2-3 years ago, it might have been hard for us, the Wellstar team, to really imagine working so closely with Piedmont, because largely, to some degree, they're a competitor of ours. However, I think the way that you have to operate in this new space is really to look at, there's going to be some areas that you can collaborate and work together on, and there may be other areas that you compete on, and you just have to look for those windows to work together. And I think that's true. In addition, a lot of the work I do with Wellstar is focused on working with insurers, and so taking that same approach and talking with them is where can we look for those opportunities to work together to, again, create value for the patients, knowing that there's going to be some areas that we might continue to compete on. This is the Wellstar Piedmont health plan that was launched right after January. Hopefully you guys have heard a little bit about that, and if not, hopefully you'll be hearing more about it very shortly. But we are very excited about that. It is, we're working right now to have a Medicare Advantage product available out in the community for January 14. In addition to that, we tend to have commercial, small group, and individual products that would be available. And part of where this originated from was that for years, different individuals or business owners would approach us and say, you know, why can't we just work directly with Wellstar around this healthcare issue? And so we started researching that and looking at originally maybe doing a plan ourselves. We actually looked at doing it by ourselves. We looked at partnering with a national payer and had a lot of discussions with them about that. And at the end, this collaboration with Piedmont seemed to make a whole lot of sense because there was a lot of synergy with us both being large health systems and kind of our view of the world. And in addition to that, it created great economies of scale for us to be able to do this together and have the administrative functions cut across both organizations. So we're excited about that and hope that it's going to lead to some very good innovative products out in the market related to insurance. And then finally, we did acquire the Center for Healthcare Transformation. That was the former Newt Gingrich group that had nationally put together a group of healthcare organizations to really look at how to create better health and lower cost. We bought really the name of this, and we really liked the concept of better health, lower cost, and wanted to facilitate that. And so we're redesigning the platform in the way that that's actually done, and invited a number of similar health systems around the Southeast to kind of collaborate with us and join with us. And it's really to create an organization that best practices can be shared among the healthcare systems. Because one of the things in healthcare is sometimes it takes a long time to deploy good ideas across the broader set of communities. So that's really what this is about. And again, we're looking to sort of be on the forefront of how do we provide better care at lower cost, because we understand that the current state is not sustainable for the businesses or the communities that we serve. So with that, I will stop and be happy to answer any questions. Or yes, ma'am.
Did you say there was going to be a 27% cut in Medicare funding to the doctors?
That is what has been proposed, and in the past that has always been, you know, the last minute Congress will come in and mitigate that or change that. But yes, ma'am, that is part of what is.
Well, do you foresee a shortage of doctors, people that have done business for years and years and just throw their hands up and say, I'm out of here?
Yeah, yes, I think if those kind of cuts were to go through, that there is a danger of, there's an absolute danger of that. And I think that, you know, that's part of what is so critical about us redesigning the financing of healthcare, because we've got to figure out, you know, how to make it more affordable, but also how to pay the providers, you know, reasonable amounts for the care that they give. And so it's trying to find that balance and trying to do it in a different way than today, because I do think that the concern is there.
And isn't there a new tax on medical equipment?
Yes, there is. That's part of the Accountable Care Act as well.
The doctors also?
Yeah, yes, ma'am.
For companies such as restaurants and those kind of things that employ folks but at lower dollar amounts, being required to carry insurance for all of those employees or pay a penalty, is there still a whole lot of conversation about what that really looks like? I mean, that could really bankrupt a lot of small companies as well as certain industries that would feel a lot of damage there.
Yeah, absolutely. There is a lot of discussion about that and a lot of debate about that. A lot of folks feel like that those industries particularly will work folks under the 30-hour requirement to be able to you know, work around that. So yeah, there's still a lot of debate about that and a lot of concern that that's probably the group of employers that may be the hardest hit by this legislation. I did just have a couple of closing comments that I was asked to share with you all. Just to mention that the brochures at your table, the Wellstar brochures, and just to highlight a couple services. First, our Wellstar corporate and community health partners with local companies to provide corporate wellness programs and health screenings, flu vaccinations, personal wellness profiles, and CPR classes. And if you're interested in any of those, please see one of our representatives at the tables today. We'd be happy to talk about that with you. And also, we have a free program called Speaking About Wellness for the Workplace, where experienced healthcare professionals from Wellstar can be scheduled to come out to your work site and provide a 30-minute to 1-hour seminar on health on the topic of your choice. And additionally, there is a Speaking About Wellness for Women has an event coming up across the street at the new conference center. It's on April 4th from 6:30 to 8 p.m. and the topic is Fortify Your Spine. It promotes relief from painful symptoms and tips to increase mobility and the range of motion. $10 tickets include the presentation, dinner and dessert, educational materials, and a free gift. So if you're able to, please join us for that. And there's a table from Corporate Community Health out in the hallway. Again, they'd be happy to talk with you about any of our programs. So thank you all so much for your time today. I really appreciate the opportunity to be with you.
Did that scare anybody? Yeah. Thank goodness we have experts like Barbara that can come and explain it to us. I'm sure if you have additional questions, she'd be more than happy to talk to you about it. But that act is a huge act. There's a lot of moving parts to it, and we very much appreciate you coming and spending time with us today. A couple of quick reminders. The Chamber's Business to Community Expo is May 4th at Arbor Place Mall. This is an opportunity to get your business in front of thousands of people. We are taking exhibitor registrations, so sign up now with Kimberly. Where's Kimberly? Did she step out?
She did.
Okay. See Kimberly or any of the ladies in the chamber. I think we have 66 total spots. They will go fast, so if your company's interested, please see the ladies at the chamber and we'll get you set up. That's a great event. I think it coincides with a touch-a-truck that the county is doing outside the mall on that particular day as well. So that'd be a great opportunity. Bring your kids out to just let them play on the trucks and go inside and see all the businesses for Douglas County. As always, we thank the city of Douglasville for the use of this conference center. We thank folks Southern Kitchen for the great food today, to Wellstar for sponsoring the event, and to Greystone, our friends at Greystone, for their naming sponsorship for this luncheon series. Thanks to everybody attending today. We look forward to seeing you next Thursday, the 28th, at the Nice Signs for their 30th anniversary celebration at the AT&T Business After Hours. Remember, board members, wear your tickets. Okay, remember to get your tickets, buy your tickets, buy early, buy often, and have a great rest of your day. Thanks, everybody. Oh. Thank you, Carol. Leadership Douglas has a recycling day this Saturday. They're taking all kinds of computer equipment, batteries, et cetera, et cetera. That will metal. It's going to be over
Old Jordan Tractor lot on Douglas Boulevard at Brightstar.
Okay, does everybody hear that? Old Douglas Boulevard at Brightstar Connector. If you got anything old that's sitting in your garage that you said, man, I need to get rid of that, bring it up there this Saturday, and Leadership Douglas is using that as a fundraiser to do the landscaping at the Care Place. So that's the project this year for Leadership Douglas. And with that, you can put your tickets in your pockets today and have a great day. Thank you.